Hi, my name is Christina Reburn, and today I'm going to talk about the Clunk test. So this is a special test for your shoulder, specifically for the glenohumeral joint. This is an instability test that looks at the glenohumeral labrum, and specifically it's looking for a glenohumeral labrum tear around the anterior side of that labrum. Just a quick reminder, the glenohumeral labrum goes around the circumference of the glenohumeral joint and kind of encapsulates that glenohumeral fossa and deepens that so it helps hold the humeral head in place. The naming of this test actually kind of explains what a positive test is. Essentially, when we're performing this test, we're looking to hear or feel a clunk. Oftentimes, the patient will also feel kind of a grinding sensation or an unpleasant sensation. This clunk occurs because of the lack of stability in the shoulder. Because the glenohumeral labrum plays such an important part in holding that humeral head into the fossa, if it's a little bit damaged or torn or broken, it can introduce a lot of laxity into the joint, which allows for movement, and in that movement, we can often get that clunking. So Lexi's going to help me demonstrate this today. Hi Lexi, I'm Christina.
Hi Christina.
If you could go ahead and just lay down on your back. So Lexi's been complaining of some shoulder pain, so I'm just going to test out this shoulder and see if we get any clunking with this Clunk test. The first thing I'm going to do is take my first hand, my hand that's closer to her, and place it underneath her posterior scapula. This allows me to place some upward pressure and also feel around for a clunk. Next, I'm going to take my second hand and grab her elbow. I'm going to move her fully into abduction, as far as her range of motion and as far as she can tolerate. Still gripping with the second hand, I'm going to start to externally rotate this arm as I'm applying upward pressure with my first hand onto that posterior scapula. So the combined motion of me pushing up and externally rotating while she's in abduction should produce a clunking or a grinding. Thank you, Lexi. Now, I may feel that clunk with my first hand supporting that posterior scapular, or she may feel the clunk. She may also feel grinding, and those are all signs of a positive test. But we do have to remember that there are always false positives and false negatives when we're performing these special tests. So just because I feel a clunk or she feels one of those other signs or symptoms, it doesn't necessarily mean that there's damage to her glenoid labrum. On the other hand, if she doesn't feel those symptoms, that doesn't mean that she doesn't have damage. Just as a standard rule of thumb, the gold standard for kind of diagnosing this labrum tear is an arthroscopy or sometimes an MRI as well. So we can never be completely sure with these special tests, although it does help us get some sort of an idea of what is going on in her shoulder.